Welcome to Recovery Talk Live, an ongoing open discussion about psychological, emotional, and spiritual recovery. Our mission is to deliver the message that those who are suffering with emotional trauma can recover. And now, here are your hosts, Don and Terry.
Welcome to Recovery Talk Live. I'm Don Maxwell with my co-host,
Terry Liddell.
And here we are again back to bring recovery to you. And again, I just want to remind people, because we've been doing a lot of episodes about chemical abuse, that, you know, recovery again, and we really started, when we started this series on this show, we talked a lot about recovery being more than that. Sexual addiction, a codependent enabler, food, I've lost 90 pounds. So it's really, you know, I just like to remind our viewers that part of our purpose is to destigmatize, and don't think just because you're sober today, you're okay, because you might have another problem.
Okay.
Okay, because I represent the other half.
Okay.
Or probably the majority.
So what are you doing today?
So today I have my special friend Gina Tabrizy here from Harmony Hills. She's the owner, founder, and she's diverse.
She's diverse.
Yes, she's diverse, and and you know what I love about her is she gets recovery as a whole.
Okay.
Because I know in the groups I've been in over the years, I see all these people in the parking lot who want to come in, who need to come in, who think, I'm not passed out on the curb, so I'm okay. And Gina gets the whole spectrum. She does trauma work. She gets that there are many types of recovery, versus a lot of places which facilitate only 12-step wellness for chemical dependency.
So she's more into whole body, spirit, mind process of putting people back together, so to speak?
Yes, and I think there's no other way than to do the whole thing.
So, well,
so she's a wizard. Now, I know she might be able to help you, Terry, too, because there's still hope for you.
You think?
I always say he's got KDAC 20, 22, 23, and many, many, many things after his name and a lot of sobriety, but I still have hope for you, man.
I appreciate that.
Gina can help you.
Okay, we're going to see. We'll see.
But you also hold credentials in domestic violence, correct?
Yes, I do. I have a lot of different areas that I've been to work in.
Yeah, and trauma is a big thing, and I'm wondering how much clinically huge do you think trauma plays into addiction and disorders?
Well, I think trauma plays into life.
Okay.
And that I don't know any of us who don't have trauma. I
agree. So I don't think everybody agrees, but I agree.
So when I look at things, it's like trauma is part of life. Everybody, I mean, you grow up, you go through high school, you go through grade school, or you go through college, you go through, and you don't have the right labels, or you don't have. So there's trauma at different levels. Suicide is a pretty good indicator that people have trauma in their life, and suicide's on the rise. So
on the rise.
And teenagers, teenagers are the ones who are doing a lot of it. So when you look at it, I think trauma is part of life and learning how to live in spite of your trauma or with your trauma, because you're pretty normal, and we don't
I'm so
necessarily.
Normal. Thank you so much. Are you telling me I'm normal? Because you've never said that before, so I'm a little flattered at the moment.
No, I said trauma's normal.
Oh, I thought you said I was normal. Okay.
But it's normal to have trauma.
It's normal. It is normal to have trauma.
So, and you're a lot better than you used to be.
I know. I'm just making progress.
So part of that journey is to recognize that trauma is not, we're not unique.
Right.
But we feel that way.
We feel isolated and alone, and it didn't happen to anybody but us.
So integration is a big deal in the therapeutic concept of taking people and saying, okay, it's okay to have uglies, it's okay to have hurts, it is okay to wander through life, and that who you are isn't defined by what's happened to you.
Although I find a lot of people are walking around feeling isolated, alone. They were not, they're the only one who was sexually abused, and they may not be using, but they've got they're about to jump off the cliff.
Well, in the ministry that I work in, we work with sexually attractive kids.
Yes.
And separating what's happened to those kids and working on who they really are is the huge piece, and they get it. So my journey, I had to get away from trauma and accept the fact that who I am is not defined by what's happened to me. So I think that's the biggest single thing that if we're going to do something for people, and that we help them understand that trauma is normal, and that you can not only survive it, but you can flourish because of it.
So for our viewing audience, because those people there that love us every week so much, and we love you too, because we want everybody to be well, because I'm codependent, I want everybody to be well.
You want to fix everybody?
I want to fix, no, I know I can't, but there's a little niche of me that just wants it.
Okay.
I think we need to define trauma, because I think my perception is, and what I see with people I work with and in the world of recovery, is people think if you haven't had a traumatic event like your parent was murdered or, you know, you were raped, that there's no trauma. And trauma comes on different scales and different levels. And just because someone had a major, what might be perceived as a major one, doesn't mean you were not equally affected if it happened to you on a lower level.
I think
So will you define it?
you just defined something that is what happens to us. Trauma is what you think's trauma. And a 2 on my scale might be a 10 on yours.
Tell the people. I see this as a missing
a 2 on my scale would be a 10 on your scale. And that it's
That's
not
true.
the degree of the trauma defined by somebody else really has no validity. I believe that if somebody comes in and says, I've had trauma, then it's like, okay, you've had trauma. And learn to live with and deal with and work with what that means to you. So,
Although how many clients have you had come in and say, you know, I wasn't really traumatized by that, and the PTSD is going, woo, woo, woo. I mean, it happens. I think you have to create an awareness.
That's part of the therapeutic process. That's part of my counseling program, is that I got to dig down in those things. But still, the concept of trauma is how I feel about it, not what other people think about it. And I think in many times.
Say that again. That was really pivotal. Not say that. Not how you say that, what you just said.
What did I just say?
It was really good. Oh, don't make
Were
me
you
repeat
listening?
it. Yes, but it was really good. And I think it's in trying to bring how recovery is perceived up here down to the layman who's afraid of it, that was important. It's perception. That
I'm going to let you struggle for a while here. This is fun. The process
You're always torturing me.
Yes, the process of understanding what trauma is anytime that I don't feel okay, that's good enough for a starting point.
That's
If
a
I'm
good enough for
hiding
a
from
starting
it,
point.
if I'm hiding from it because of PTSD or something traumatic events that I'm trying to get away from, and I put them in the back parts of my mind, as you deal with somebody in a counseling situation and those things come up, we often try, as the person who's been traumatized, we try to dismiss them, and part of our job as professionals is to try to help them unpack the suitcase, so to speak.
And the marker takeaway, because I always like to represent the person who's unfamiliar, and our mission to destigmatize is if you're not feeling okay. You may not be able to define that you are in trauma, but you know internally something is wrong. That's a good reason that your body and your psyche are crying out for help.
Yeah, I firmly believe that we have 3 aspects. We have the spiritual, the physical, and the emotional parts of our body. And that if those aren't reasonably in tune with each other, we've had trauma and something's going on. So when people come in and sit down, and it's like, I listen to what they say is going on, but my job is to see if I can't sort out what's really going on and help them learn to deal with it.
So looking forward into recovery, and we're going to touch on this with Gina in a moment after the break.
I think it's going to be a lot more in touch.
She's very in touch.
Well, I know that, but we're going to dig into what she's doing.
We're going to really dig in because
if she's half of what she said she is,
I know, I really build her up. Poor thing's probably sweating over there.
This will be a good one.
She's going to come off the throne and sit with us regular folk
with us.
over here today.
I like it.
Because I tend to put her on, she's just very good at recovery. And what I really appreciate about her as a clinician is treating the whole person. And a lot of places that I've experienced don't treat the whole person. If it's a dual diagnosis situation, they'll treat the addiction but not the brain disorder.
Yeah, no.
Everything has to be together. Would you agree?
So. Yeah.
Prior
I think I said that earlier.
Yes, but this is an important step in bringing everybody on the same page.
So we shall see.
So we shall see.
Look forward to meeting you.
So come back after the break where you will meet Miss Gina Tabrizy from Harmony Hills. We'll be right back.
You're watching Recovery Talk Live. If you would like to contact Dawn and Terry, please send your email to recoverytalklive@gmail.com. If you have any questions, comments, concerns, or insight, we'd love to hear from you. Your identity will remain anonymous and your name will not be revealed on air. Again, send your email to recoverytalklive@gmail.com.
Welcome back. I'm Dawn Maxwell with
Terry Liddell.
And we are here with Miss Gina Tabrizy from Harmony Hills. Welcome, Gina.
Hello.
Thank you for joining us today. So can you tell our audience about what you do at Harmony Hills? You're located in South Orange County.
Sure. I'm a marriage and family therapist by trade, and I've been in the field for 27 years. And Harmony Hills is an outpatient center that has grown into some residential treatment as well. but our primary focus has been with addictions and trauma, which you guys did a great job of covering a little bit earlier. I was listening in to that.
Good.
Yeah, so I appreciate that. And we have a lot of services. So, you know, it's a mental health facility, so we look at the whole picture, like you were saying.
Right.
And, you know, dual diagnosis means I've got an addiction operating along with a mental health issue, and that could be anything from depression to anxiety to, you know, obsessive compulsive disorder. But we get a broad spectrum. So we have some severe clients who are now in the stage of paranoid psychosis, schizophrenia. So we have enough clinicians and we have a team set up. So if someone comes in with something other than just a primary alcohol, drug dependency, or some type of addiction, an eating disorder, or a sexual compulsion or whatnot, but they've got some severe psychiatric issues, then we've got psychiatrists and physicians and neurologists and a team. What happens is, being in the field for a long time, I started working with trauma.
You did.
I didn't want to work with addicts because I'm a flaming codependent. And
See?
I don't know.
flaming,
I
like,
give you some
like,
competition.
you know,
See?
seriously, like goes
yeah.
with the hair. It's out of control. But
hear it.
you know, I needed to figure out how to get me well, and so I went through my own recovery. So I've got probably about 25 of those 27 years in recovery for codependency. And what I saw was I always attracted addicts.
Yeah.
You know, they always showed up. You know, wherever I went. So it could be social, it could be in my office, it could be at Sears. I'd get on the Sears elevator,
you,
and sure
sister.
enough, there would be an addict wanting to tell me their story,
Yes,
you know? So I'm
yes.
like, okay, I think maybe I should look into this. With the trauma as the primary component, there is no trauma without an addiction, and there is no addiction without a trauma.
Okay, so let's explain that
That's
to the
a-
audience. There's no
yes.
trauma.
This is a Gina-ism.
Okay,
Okay.
let's tell the Gina-ism,
Yeah.
because I always try to talk to the lay viewer
Absolutely.
who's unfamiliar with recovery. So we explain
Absolutely.
that further to them.
There is no trauma without an addiction, meaning that in your trauma, you are going to do something to cope, whether it's
Okay, there you
shopping, obsessively shopping for shoes, which was my favorite, eating, sex addiction. It could be, you know, alcoholism, drug, you know, the typical what you see, but there is some obsession or some compulsion operating to numb the feeling that the trauma brought up for you.
Okay, and I'm really loving this because the premise of this is to destigmatize, so we know that recovery is for everyone.
It is
So
absolutely
you're
for
completely
everybody.
embracing that, and clinically you're agreeing with what
Am I?
Gina's
Yeah,
saying.
absolutely.
Yes.
I
Yeah.
think she's, we have coping mechanisms in order to deal with whatever happens to us, good or bad. And so if we have an inappropriate coping
Right.
mechanism,
Right.
we're going to do something to compensate. And typically that's a pretty good indicator that we have a trauma that's pretty significant,
Right.
that hurts.
Right. And what's very, what I'm really liking about your facility is that you are recognizing the multiple levels, that you do
Right.
need to treat the psychiatric
Right.
with the addiction.
Right.
And personally, I don't see enough of it.
Well, I think,
Out there.
you know, secondary, you know, to what I was saying, when I say there is no addiction without trauma, you know, if my clients come in and they don't report any kind of, and you go down the list of, have you ever been physically abused, sexually abused, et cetera, a lot of times they say no. And then I ask about their addiction, how long have you been an addict? You know, in your addiction, did anything traumatic happen to you? Oh yeah, all the time.
That's how
You
you
know, I
get 'em.
robbed, I got jumped, I was assaulted, I was raped, I was beat. And I go, you've got trauma. It's not always, right, in early childhood, or though oftentimes it is, and we're just repeating a pattern. But with the addiction then became the traumatic event. And I say, if you have been an addict, then you have had trauma. Because even the act of addiction, if you look at it in some ways, is self-destruction.
Self-abuse.
Right? So it's
Yes.
self-abuse. So you inflicted the trauma on yourself. When I started working in, you know, I've worked in a bunch of different facilities, and psychiatric, straight, what we call straight CD or chemical dependency, they didn't look at this piece. They are starting to more, but it's not the first thing, because it is the belief, and it's more, you know, 12-step oriented programs, of course, or a social model is what, you know, primary
Right,
CD or
right.
alcoholism is they want you to just get clean, and they
That's
want you to
exactly
focus
it.
on that addiction. This stuff deal with later, or it's an outside issue, or deal with it with a therapist. But what happens for a lot of people is their trauma keeps interfering with their ability to stay sober. They get sober, the trauma comes back for them, especially if it's severe, you know, as in the case of sexual abuse, you know, or physical abuse, or neglect even for some people.
Boy, that's accurate.
Now, the beautiful part I always tell my clients is, you know, Pia Melody, who I love, who's the other guru of the Melody Beatty and Pia Melody, I'm putting a plug for them, on codependency, is she wants to find it as anything less than nurturing. And I went, oh, Jesus, everybody's been traumatized if you think of trauma in the way of anything less than nurturing. But it normalizes it too. When you start to talk to clients about that, then they're not as afraid to tell you about the heavy stuff. If you start there, oh yeah, you know, my mom didn't pay attention to me, she never hugged me, I was left at home, I was a latchkey kid. Sometimes I'd walk home, there wasn't food in the fridge. It could be that simple. It isn't always that severity.
That's so brilliant at the level you're saying it, because it opens the door. There's everybody up here who points a finger at all the people that they think need help.
Right.
And I was just, I think it was in the last episode we did with Butch, my experience as a codependent is when I was looking at everybody else, I didn't have to look at myself.
Absolutely.
And so that
you could call that an addiction.
Oh, it is. To me, it is. I mean, you just opened the door at the bottom.
I think you said something that I was sitting here going, yeah, that's really good. Is that
I do that sometimes.
That's
once in a while.
Yeah, that's really good. Is that I think that it really says that we often don't get a real good history.
No.
We jump on the first bus that's going by, and it's funny because that's one of the things that I do is I really work on getting a big history, and that's powerful. And I hadn't really thought about it in that light, but that's yeah.
For them, it's destigmatizing what is trauma, and then it's defining it. I don't know what it is, so my brother fondling me, I might not have thought, oh, that's a trauma, so I might not report it to you when you ask me if I've had a traumatic event. You did not know that it wasn't normal, or because you didn't experience it as an injury. So that perpetrator wasn't aggressive or wasn't violent. Sometimes they feel the shame of, oh, it felt good, so therefore it wasn't traumatic, and not understanding that a violation still occurred. So there's a lot of explaining in that, you know, history taking.
Yeah, I'm digging. Yeah, that's true. I grew up in an alcoholic violent house. I didn't know that wasn't normal.
No.
I went out in the world. It worked.
Right. And
scary.
You expect to go to other people's houses and it looks the same, and sometimes until you go somewhere else and you go, oh, this is how your family doesn't do this.
There's something wrong with you guys. Like you're
not going to get beat for that, or you're not getting yelled at. What's wrong with your dad? Like you go the opposite. The other part of that too is that Alice Miller also wrote, you know, quite a few books, and she had an expression about, you know, children don't idealize or make the parent appear better than they actually were, because idealization of the parent in childhood was tantamount to their survival. Okay,
That's
so
true.
they come in and report, my parents are great, and they were in an abusive, assaultive, angry, violent home because, as you said, it was the norm for them. But believing that that was the norm is how they survived it. So then they don't report. So a lot of this history taking doesn't occur, especially in early recovery. And when it shows up, most of the treatment facilities, either the staff is not trained or it's, you know, out of their scope, which is appropriate. Don't touch anything out of your scope. So they don't touch it. They go, we'll just key mark that for another time, or take that to a therapist when you get out of treatment.
Make it to the next level,
How many people are going to do that? Let me write that down in my big book. Go see a therapist for my sexual abuse. I'm going to do that tomorrow. Let me go drink, and then maybe I'll hit it on Wednesday. You know what I'm saying? Like, they're not going to look for that.
Well, those are we have the compensating behaviors. Right. I can't handle walking down that street. So no, I think it's
anything
huge.
To numb, avoid, and deter from that. So, you know, a lot of times I would tell the clients, they go, why do you want me to deal with this now? You know, like fresh, you know, I'll tell my friends fresh off the boat, because my parents are Cuban, so I can use that phrase. But, you know, they'd come in to treatment and go, why are you touching this stuff now? I go, because I don't know if I'll see you again. I don't know if when you walk out, you OD, I will never have the opportunity to help you heal around this injury, because I see that you keep going to that place and then you get loaded because it's an open wound.
We're teaching
This is awesome.
avoidance.
Avoidance.
Yeah, we got to stop avoiding what we avoid.
Oh,
we
yes.
gotta
It's
start,
a culture of
we gotta
start digging.
dancing.
It's something I read about. I got some stuff I'm reading right now, and it was like, wow, because
we teach it.
We
definitely
radically
everywhere. And of course, take a pill for everything,
Sure.
and you shouldn't feel anything. But take a pill to fix this that you're feeling, but you might have 25 other things that, you know, your body's gonna, you know, you're gonna have tremendous gas and your teeth are gonna fall out, but this will help your depression.
Yeah.
But why not just talk about it, you know? There's, you know, neurology, okay? So there's physiology and there's chemistry to addiction. It does alter the brain. It does affect those pathways and those neurotransmitters. So you cannot ignore that physical piece, and damage gets done there. So sometimes supportive medication can help. And this is difficult because, you know, it's a 12-step program. They would not necessarily support or advocate for that, but certainly yes, as long as by a physician, it's prescribed and you're using it as directed, then okay. But oftentimes there's a stigma, so I want to say to those clients who are dual diagnosed, they're scared sometimes to walk into an AA meeting and say, I'm not clean, you know?
It's
There's a little
interesting,
bit.
yeah, because that's my journey of recovery is 12 steps. On the other hand, I believe in short-term medications because they make sense. I mean, you're unpacking some stuff that's pretty ugly.
Right.
Not everybody in AA
And,
believes that.
Well,
though.
I don't
No.
care.
I'm just letting you know, there are people out
I
there who
don't
feel,
care.
I know
That's
you
why I
don't
brought
care.
it up,
But
because
what needs to
I'm-
be
Because
addressed
it's-
because
yeah.
people feel ridiculed, they're not getting treated.
I know, but
And
I don't
that
care.
scares me
And that's
Yeah.
alarming.
Right.
Yeah.
Because the supporting, it's like, it's so dumb. And I guess I use this, I go into the hospital because I got a broken leg.
Right.
Why am I taking medication? Why am I letting them set my leg? Why am I letting them do all those things? But AA says you can't do that. It's like, wait a minute, I have
They do.
damage. Why can't, and emotional damage is usually far more severe than, in long term, than any physical damage we get. So yeah, I'm for it.
Yeah, so with medication, I mean, my point being, not so much on program does advocate and support as long as it's directed. You're not abusing it. Again, it's monitor.
As
It's
prescribed.
as prescribed, and
Length of
make sure.
time.
That's right.
And
Let
then
your
we're working
sponsor
on
know, let, you know, the
everybody
people in
know.
your life know.
Yep.
And for me, it's that sometimes with some of these mental health issues, there are clients, a bipolar disorder, for example, they need medication.
Yes.
You know, any
Forever.
bipolar clients
Forever.
that I've had that get off their meds, you know, I had some severe trauma around clients who committed suicide because they felt great, started feeling good, they were out of therapy, putting their life on track, and then jumped in front of a train, you know, or jumped off a building because they got into a manic state getting off their medication. So, I mean, the point is to, again, not abuse, because the tendency and that obsession, right, and in addiction is to then, I can't, I'm going to abuse, you know, you put it in front of me, I mean, put a Vicodin in front of a dope fiend, come on, that's candy, you know, you're setting them up. So there has to be a team, and that's why Harmony has that team to support when someone has those needs and how to help them wean off or taper off to get in a better, healthy place. I was at our detox, actually, yesterday, and going through a training. One of our staff, Michelle, was given a training, and I sat in, and she was explaining some of the ins and outs about, can you imagine, you know, this is all you do to cope, and then you come in and somebody's advocating for you, know, okay, we're not going to give you this, we're going to take this away, you know, it's like a kid with all their toys. I'm just taking all this away, and I'm just going to leave you raw. It's so frightening for them. I mean, I was just sitting there, you know, as she was walking through the process, feeling what they must feel like to then all that, handing over all that, right? That control,
It's
that
a lot of surrender,
powerlessness that you
yes.
talk about. That's a lot. Like I really felt it, you know, sitting there with her in a different way, you know, sitting in the seat and watching that happen.
You're asking people at that level to trust somebody that they have no idea.
No
with
idea.
nothing, and you
No
want me
idea.
to trust you? Okay,
Yeah.
that's a no.
Yeah, absolutely.
So anyone
Yeah.
can walk into your facility. They don't have to be chemically dependent. It's okay if they have a brain disorder, and you can help them. Can you please tell our audience how to
Yeah,
get a hold of
brain
you?
treatment.
Phone numbers, websites.
Oh, I'll forget the numbers now
It's
that you asked
okay.
me. Harmony Heals Inc., and the line is 949-837-2751. It's www.harmonyheals.com. We have also Harmony Heals Sober Living, Harmony Heals Detox, probably forgetting another one. But if they look us up or put in my name, you know, Gina Tabrizy, they'll find all of our
And then
services.
men and
There's
women,
800
children.
numbers and all that, which I
Tell
don't
them
remember.
who you treat. What?
Oh, we treat a spectrum anywhere from like 3 years old to
That's amazing.
100 years old, because we have staff that
Amazing.
works with geriatric clients, and
Oh.
we have staff that are trained in play therapy. Again, because the expertise is in addiction, so we have family components. We love to work with the family in addiction. We love to work with the kids while mom's getting sober. We love to wrap around that, as well as the holistic piece, which when we were talking about meds and how we treat and that's the other piece that's critical, is because we do fitness, like I'm a fitness freak, I'll call myself, a martial artist and yoga, so is my husband. And so we kind of grew up with the mindset of always caring for the body. That's your temple, you know, and you have to care for it. You know, every day that you breathe is your right to be on this planet, to be at 100% if you can be. So again, at the detox, I was joking with them because somebody was vaping. They have those vapes now. But hers had a little nicotine in it. So she was walking in the house and she's one of the staff. And I go, hey, what are you doing? She goes, I'm vaping. And she got very nervous. And I'm like, uh-huh. She goes, do you know what vaping is? And I go, yeah. And she's like, just looked at me like deadpan eyes. And I said, I want you to take that outside. And she's like, puzzled. And I said, it's behavioral. You're still role modeling the need to put something else in your body to feel good about you. And I said, I love that you're taking it a step down and you're tapering it off, but you're still role modeling that.
It's the behavior.
So let's take it outside. If you were smoking, I'd ask you to step outside. Why? Because it's harder. It's a pain in the butt. You don't want to do it. It's uncomfortable. Now you're not having fun. Maybe you'll think about, do I really want to walk outside, load the vape, go? I'm just distracting you from another place that you go where you don't feel well, you know?
Breaking
Get well.
patterns,
patterns
that have been very consistent in our life is huge.
Oh my God.
Yeah.
Yeah. So every opportunity that we have to do that, you know, we do that.
You were talking about, because a lot of what you're describing is working with PTSD.
Oh yeah.
Yes.
And
Oh yeah.
yeah, and so that's cool.
Yeah. We love it.
Yeah, you're having fun.
Post-traumatic stress disorder.
No, I'm
gotta
having a
let them
little
know.
She's having fun.
I'm
Yeah,
having
you
a
can
little
see it. You
Yeah.
can see it.
So
Yeah.
if anybody
I have a
wants to
good
call
time.
you, and I would encourage people to call you because you're kind of the exact thing that Recovery Talk Live is about, just bringing recovery to everyone.
Everybody.
And treating that whole
Everybody.
person,
Yep.
taking the stigma
Yeah.
away.
Well, we'll go out, we'll tour. I speak anywhere you ask me to come.
She will go
to speak
anywhere
and
you ask
educate
her to come
for free.
for free.
And I do that to give back too. We have addiction on both sides of our family as well.
Yes.
And we're all about, you know, it's not okay that people can't get those resources. There are resources. It's not just for the rich. You don't have to go to the $100,000 rehab to get help. And if
No.
we don't have it, we're going to get it for you. We have people call all the time. Our sober living and detox is just straight female right now. Hopefully we'll add a male component. When the men call, we will not get off the phone until we have that person somewhere. Like, oh,
That's
sorry, we
awesome.
don't have it.
That's awesome.
That doesn't work. That doesn't work. If I don't see it all the way through, I'm not role modeling that for everybody that's in my world, my children included.
good.
So you start something, you finish
Very
it.
good.
you know.
Amazing. Thank you so
Thank
much,
you.
Gina Tabrizy,
I
for
could
coming.
Go on with you guys
Awesome.
forever. This is great.
This
It's so
is
fun.
great.
Well, I
Thank
appreciate
you.
you
I
coming.
enjoyed it.
And thank you for joining us today on Recovery Talk Live with Gina Tabrizy. Check her out at Harmony Heals. Great job. Have a great day. Stay sober. Stay well. We love you.
You've been watching Recovery Talk Live. If you have questions, comments, concerns, or insight, we'd love to hear from you. Send your email to recoverytalklive@gmail.com. That's recoverytalklive@gmail.com. Look for new episodes every week, and thanks for watching Recovery Talk Live.